The fifth birthday of Obamacare, the national health care law has faced 5 years of constitutional challenges, and right now all eyes are on the United States Supreme Court because the United States Supreme Court is deciding a case, King versus Burwell, which could determine whether Obamacare lives or dies. And Senator John Barrasso joins us, who's also a doctor. Nice to see you.
Thanks for having me.
What do you make of it? I mean, this may be a colleague of yours in the U.S. Senate. She won't come on and talk to us about this great idea where this nonprofit hospital, which has been serving poor, is probably going to get shut down, go bankrupt.
Well, it's terrible. And, you know, across the country, 43 rural hospitals have shut down since the Obama health care law has come into place. That's affected communities in many, many ways. So here we are on the 5th anniversary of the president's health care law, and all across the country, Americans do not like this law.
Well, I can't get away from the headline, nonprofits serving the poor, and then you've got a candidate who's running for Senate with a union who's got everything to gain from not having a lot of this happen. So it's very distressing. She ought to come on and defend it, don't you think so?
Absolutely. I'd like the president to come on and defend the health care law, to talk about some of the issues that we've seen. There are a lot of reasons it's so unpopular. And the costs have gone up. Remember what he promised. He promised the cost actually of insurance would go down by $2,500 per family. All
right. What is the Republican plan in the event, I don't know how the Supreme Court's going to decide, but in the event the Supreme Court guts King versus Burwell and takes away the subsidies and credits from the states that did not set up their own exchange? What are you going to do about it?
Yeah. One is we want to set up an off-ramp from Obamacare and get the decisions being made much more closely to home at the state level, where people will have much more freedom and flexibility and choice so that people can actually get the insurance that works for them. They have a lot better idea of what they need than the President of the United States does.
Is there any discussion now between the Republicans on Capitol Hill and the President in the event? I mean, no matter what, I don't know what the Supreme Court's going to decide, but at least for the benefit of the American people, there ought to be a dialogue so that at least we know what, plan A or plan B.
Well, I brought that up to the president at the White House right after the new members of the Senate, and we took the majority in January. He said they had no plan because they thought that the Supreme Court would rule their way. He said we have 5 million happy people. He said, and I know who they are. So the president is really dug in, and his argument is just that there will be people that may be left without coverage. Well, the Republicans are ready to make sure that we can protect the people, but not protect this awful health care law itself by forming a bridge, an off-ramp to get these people to making decisions at a state level where they can get better coverage and better care.
I don't know what's going to happen in the Supreme Court, but all I know is that at least I would be ready for it if because I know the uncertainty of the Supreme Court, and that would be the fair thing to do to the American people.
We're meeting every week, Republicans in the House, Republicans in the Senate, to come up with the best way to make sure that we can protect the people, but not the law, and get the decisions made locally. And there are a lot of good things that we can do to help, but you really do need a Republican president in the White House who will sign the repeal and the replacement law.
Senator, nice to see you, sir.
Thanks for having me.